it. So are you done, Lynn?
Yeah, done. Thank
Okay.
you.
It should close.
Mhm.
Maybe I better close it. Let me just close it real quick, okay?
Yes, thank you.
So everybody has it out. Let's see. Like correct answers after. I'm going to just put that. Nope. Okay. I think I'll put this over here. Let me just do this. You can see this over here?
Yeah.
Don't get to it. I'm not going to make you sit through all of this right now. I'll post this another time, but I wanted to point out the learning objectives for the week. So just a question, because this is a new thing, trying to come up with essay type questions and everything. What would you think about taking a couple of the learning objectives? I mean, we can't make them long ones, otherwise you guys would have to write too much, and using those as our essay question. So at least you would know what it was.
Yeah, I feel like using the case study questions are a little bit more helpful and require more like critical thinking.
So you want to use, you think those are better? Okay.
I think, yeah, it helps just put things into actual perspective, because when we go over the case studies, like when we're on the Zoom with either you or Ms. Gifford, you both assist us to think in a way that we wouldn't be able to on our own. And so it gets us thinking about like certain processes and specific situations and aspects, and what kind of nursing care is required or what you need to monitor for and things like that. So I prefer the case study questions.
I think you need both. I think you need to understand, the whole concept stuff and everything. But I agree, like you sharing about your dad and Claudia sharing about her mom, and it puts a picture to what you're reading about, right? So that's true. So this case study goes around KB. He's 76 years old and he has a 2-year history of having Alzheimer's disease. He has become increasingly depressed and paranoid, and recently started a fire in his kitchen and fell down a partial flight of stairs yesterday. So his children have come to the Alzheimer's unit at the extended care facility to discuss possibility of putting him in the Alzheimer's unit. You assure the family of your experience in addressing the questions and concerns, and most concerns, I can talk, in addressing the questions and concerns of most people in their situation. So I think the best way to do this would be does somebody have their case study open?
Yeah, I answered number 1 for my group, so if you want, I can read it and say what I put.
Okay. Yeah, go for it.
Okay. So Alzheimer's disease typically proceeds through 7 general stages. After the family describes KB's behavior, you determine that he is in stage 5 of Alzheimer's disease. Place in order the stages of Alzheimer's disease, with 1 being stage 1 and 7 being stage 7. So A, memory lapses are beginning to occur that no one else notices. I ranked that number 2. For B, the person cannot respond to the environment or control movements. I put 7.
Let's see, for B, it's 7. I think that's right. Yes. Okay.
For C, family and friends begin to notice problems with memory and judgment. I put 3. And then for D, personality changes take place and the person needs help with ADLs. I put 6.
Yeah.
For E, the person is not yet experiencing any memory problems or impairments. I put 1. For
Okay.
F, difficulty performing complex tasks and arithmetic becomes obvious. I put 4. And then G, the person begins to need help with day-to-day activities. I put 5.
Perfect. Yes, that's it. So where did you find those answers?
I didn't find those answers anywhere. What I did was I read through all of them, and then based on severity, I started I started with number 1 for which seemed the least severe, and then I put number 7 for whichever seemed the most severe. And
Good.
once I did those, I kind of read the other statements and try to put those in order based on number with what it described.
Perfect. Yes. That, does everyone get that? That's a great way of explaining it to Nicole. So she took the one with the least, what's that?
Oh, never mind. Well, I
No,
just,
no.
as I remember, in our proctored exam, there was one question about Alzheimer, and it's the choices is like, or the question would be like, what would increase the patient to be at risk at fall? And the choices are, yes, it's called put the bell for bed rails up and turn on the
Are you on, okay. Are you on another question?
yeah.
Okay.
Yeah, I feel like it's like reflecting, and I think I got that wrong because every choices is right, but then I don't know which one is the,
Oh, I see what you're saying. Okay.
yeah.
So the way Nicole did it, would that help you to take the two extremes and then fill in the middle?
um I'm kind of like wondering which one was the right question on that one, because I put like it would be at the patient would be at risk for fall if the wheelchair are locked, but I'm not sure.
We'll get there then, because we're gonna go through all of them, aren't we?
Okay.
You're confusing me. It's been a long day. So,
Remembering the
you want to
proctor,
go, does Mrs., do you go step, like, answer by, you know what I mean? Like question by question? Is that usually what you do?
Yes,
Yeah.
she'll have us read like the case study progress and statements. She'll have one of us read the question and then answer it, and we just go in order. And then once we all say what we thought it was, she'll confirm the correct answer most of the time.
Gotcha. Okay. So, Elise, do you want to do number 2?
Okay. Let's see. Number 2, it says, what precipitating factors may have resulted in KB's fall? Let's see.
So go back up to your first,
Yeah,
or go
from the
in here.
scenario, right? From the
Yeah.
scenario?
Uh-huh.
Well, it says he was paranoid. So, let's see. He became increasingly, he was paranoid. That probably has something to do with him starting a fire in the kitchen and his fall.
So the fire in the kitchen, what do you think, Lynn or Claudia?
I'm thinking the fire in the kitchen probably happened because he forgot he was cooking.
Yeah.
Like yesterday, I forgot I was making noodles and then my whole water evaporated. So, so I think that's what happened to him.
Right.
Mhm.
Anyone else? Nicole or Lynn?
I said, so I was kind of confused by this question just because the scenario didn't have like a whole lot of information in regards to specific fall risk factors. But so I said that he has stage 5 Alzheimer's disease. And then I also came up with other potential scenarios, like maybe there wasn't adequate lighting in the room and he couldn't see, or there's a rug and the corner of it was like folded up and he tripped over it. Maybe he has like cords on the floor that aren't secured or taped down. He's confused. It's possible that if he's becoming increasingly depressed and paranoid, there may be like mental health issues that are affecting his cognitive impairment. Maybe he was wearing socks that aren't non-slip. He could have impaired gait or balance, and that resulted in a fall.
Good. All of those, really. Yeah.
Yeah, I just wasn't sure what like the correct answer is supposed to be because there wasn't a whole lot of like specifics in the scenario. So I wasn't sure if we were supposed to pull directly from there or also come up with other potential factors.
Yeah. So I know I was just looking at that myself going, well, they don't really tell you a whole, I guess you're going to have to, like you did, kind of pull it out. What you think that he fell down the flight of stairs. So I'm thinking he's like you said, confused. He's not paying attention, like Claudia said. Agitation. Where did they say about agitation? Oh, I guess paranoid could be construed as agitation, I guess. And patients at this stage of AD have impaired judgment and problem-solving abilities. Aging can also contribute to some problems with the mobility and balance. Okay. So what's number 3? Who wants to, how about Claudia, do you want to read as this case study progresses?
Sure. KB's daughter states, "How are you going to take care of him? He wanders around all night long. He cannot find his way to the bathroom in a house he has lived in for 43 years. He cannot be trusted to be alone anymore. He almost burnt the house down. We're all exhausted and we can't keep up with this. You acknowledge how tired they must be from trying to keep him safe. You tell the family that Alzheimer unit have been created to provide a structured, safe environment." Question 3 asks, describe 5 specific nursing interventions that are part of national patient safety goals aimed at minimizing fall risk.
Okay. So do you have an idea?
Probably the only thing I can think of right now is having the bed lowered.
That's good. Yeah.
And like Nicole said, like getting rid of rugs, like, or I'm not sure.
How about you, Lynn?
Is putting the bed rails up, would that be confinement or?
If you only have 3 of them up, you're not, you can't have all 4, but you can have 3. And what I've noticed, what we've been doing is leaving the one kind of up towards the head of the bed down and still leaving the ones on each side of their feet, because you know how they'll work their way off one way or another. But if you put the head of the one down, then you have only 3 up and you're okay with that. What about Nicole, you got anything in there?
So for number 3, I said assess patient's risk for falls, implement interventions to reduce falls, educate the patient and family on fall reduction strategies, position the client's items within reach. That way they're not like laying in bed and reaching over and falling out, and then keeping the bed in the lowest position with just the side rails up. That way If they do get out of bed, they're not like falling out because they're already in the lowest position. And then if you have all 4 rails up, it is considered like confining them. So
Yeah, yeah.
I'm not sure. Yeah.
So, Elise, do you have anything else?
No. I mean,
So I'll show you what they, oh, go ahead.
no, I mean, if they're in the hospital, I mean, you want to make sure they're close to the nurse's station.
Yeah, you can do that. Or you take them out of their bed and bring them up to the nurse's station. So these are what they put down, guys. Keep necessary items, including water, phone. Someone already said that, within easy reach, you know, making sure their call light is there, bed in low position, no more than 3 arm rails up. You can use bed alarms, mat alarms. In the hospital now, they probably don't have it in the long-term care, but they have you guys saw that? I think they're called Avis, where it's like a camera in the patient's room. So it's in place of having a sitter in there. And then they have, it's like a video camera that there's like a group of techs that watch and remind the patient to stay in bed and let people know if they're trying to get out of bed. The non-skid shoes for walking. And, you know, teaching him about turning his body in the direction he needs to go. I swear with my dad, he used to he would do things like he would just get up and start walking. And it's like, wait, where's your cane? Where's the, you know, so things like that. I mean, that's why he ended up falling, because he didn't pay attention. But so these are what they have, okay? So your next question, Lynn, did you want to read it?
KB's son asks why you can access the unit only through a door that has a keypad control. He wants to know if there are violent patients on the unit. How will you respond?
Why do you think they do that?
Well, they want to protect the patient from like wandering or leaving the facility,
Right.
and it would alarm if I don't know if they have like a bracelet and
Oh, I haven't seen those. Also, I'm thinking that having only one door, you can man one door, right? You can see who's going in and out of there.
okay.
Elise or Nicole, you have anything else there? No? No? Okay. So Nicole, do you want to do number 5?
Sure. So KB's son asks whether his father is going to continue taking the Donepezil daily. How would you respond? I was only answering questions 1 through 3 for my group, so let me look up that drug real quick.
Okay.
So it's a cognition enhancing medication that can treat Alzheimer's. So I would say that he should continue taking it if he's in stage 5 of Alzheimer's and is having cognition impairment issues. It may help.
Yeah, and anyone else have something more to say? Elise or Claudia? Yeah, they mention here also, which makes sense, you know, like you're saying, he's already confused, and in this stage 5, don't mess with his medications, right? And he's going to be moved into a new facility. So everything I would imagine everything you can keep the same as long as it's not, you know, having any bad effects on them. I would say keep it going. And they do also mention that even though the positive effects, the family might not think that it's helping anymore, but pulling the medication out, you know, like it's stopping them, that may hurt them more, right? Because these kind of medications, you don't want to just stop. Does that make sense? So Elise, do you want to take number 6?
Okay, it says, you relate that care on the unit is delivered by an interprofessional team. In addition to the physician and nursing, name 4 other team members who will likely be involved in KB's care and the role.
This might be a good essay question. I think, what kind of interprofessional or what kind of team collaboration you think would be working with KB?
Yeah, dietary would be
Yep.
one.
Mhm.
Probably, I don't know how, maybe a case management.
Social worker or case manager, yeah.
Case management. I don't, maybe utilization review.
Think about people, think about what is happening with him. So you already said dietitian and a more like a social worker. What other things is going on with him that we're concerned about?
Well,
His
he has-
cognition.
Cognition. So what about maybe a speech therapist?
well, yeah, I guess so, but
Um,
yes, yeah, I know he has cognitive issues, but if he has Alzheimer's, how is he gonna, how is that gonna really help?
Well, they teach, basically, they help teach the patient little strategies to remember words, or, right?
Mm,
So that helps cognitively and speech-wise.
okay.
Because you can imagine how frustrating that starts to get if you just all of a sudden can't remember the word and it's in your head, but you can't remember it. So these people can help work with patients to come up with strategies to.
But in the real world, do they really do that? Because when I worked in the convalescent hospital, I have never seen them work with Alzheimer's patients ever.
Well, Elise, there's a lot of stuff that's not getting done that I hope as you guys go out into the nursing world that you guys will push, because I'm telling you, I know I've mentioned my dad before, but the experience we had with him in the convalescent care home really is what killed him. So, and there were so many things, but we couldn't go in and see that. You guys are learning in these books. I could have had any one of you guys go in and take care of him and it would have been a whole different story. So you can't forget these things. So maybe they don't have a speech therapist, but it might be something you ask about and recommend. Or maybe the family asks, what more can we do? Maybe they can hire someone.
Right, maybe.
But what other people? There's 2 more that I know you guys that kind of go hand in hand. Probably more helpful in some ways than the speech therapist.
Occupational therapy.
Yep. Yeah.
Maybe someone from pharmacy to like further in depth teach about the medication, signs and symptoms to report, stuff like that. That
wouldn't be bad. But the other one I was thinking was a physical therapist. But that wouldn't be bad, Nicole. But that may fall on you as the nurse to collect that information from pharmacy and get, you know, get that patient, those care notes together and help teach the family.
Yeah, I was just trying to think back to the care conference that we got to witness last week at Me Memorial. Like there was a doctor there, there were 2 case managers, there was a social worker, there was someone from pharmacy.
Good. Yeah. When we did, I mean, that's a great example. When we did in the NICU, we would have a little preemie that, you know, we would have social worker, case manager, lactation consulting, nutritionist, the doctor, physical therapy, you know, all of them come together, and the parents actually would come. So yeah, I don't think that's a bad idea. So the ones they have here, but this is not because they're just saying, hey, come up with 4 other team members, and you guys did. But they have dietitian, social worker, occupational therapist, physical therapist, and a speech therapist. So with the occupational therapist, what do you think they do that the physical therapist isn't doing? Like, what is their job?
Strengthening, work with conditioning, strengthening the patient, maybe walking them.
That's more physical therapy.
That's
You're
what I thought you
asking
said.
about-
Is it they help try to get back to like their activities of the daily living?
Yes, they're going to come up with different strategies for them to, like, let's say anywhere from eating, maybe drinking. Like there was this one patient we had with well, Nicole, you talked about things occupational therapy has taught your dad over the years, right?
He more so went to physical therapy. I'm not too sure about occupational therapy. As far as his ADLs go, like it's mainly just my immediate family, like my mom, my sister, and I that help him with that.
Okay. Okay, so the occupational therapist would, well, I'll just say it the way they have it. They can suggest ways to adapt the environment and focus on what the person can do and maximize what he can do on his own, okay? Promote safety and with doing that, with allowing the person to continue doing what they can, it actually gives them a deeper sense of a quality of life, right? Who was next? Nicole, you just did that one, right? Claudia, number 7.
Okay. You try to comfort the family by telling them the problems they are experiencing are common. You explain family support is a major focus of your facilities program. List 4 ways in which KB's family might receive the support they need.
What do you think?
Maybe the social worker could talk to them.
Okay.
Maybe and teach them. I'm not sure actually.
So you let's see. So you're trying to comfort this family, and you're telling them that all of this that's going on with them is common with how old their dad is, with Alzheimer's, that this is common, but you want them to stay part of his care. You don't want to just say, okay, here he is, bye. You know, you want them to feel involved. So what it's asking is, how do you do that? How do you keep them involved?
Try to visit him.
Yeah, encourage visits now with COVID, but we can do FaceTime, set up FaceTime appointments, get a daily schedule going for them.
Maybe bringing like pictures.
Yeah.
Or,
Um, and then let's see, what about, so he's been living on his own. There's probably a lot of money issues, financial issues that are going on also. So maybe find someone to help them figure out all of that. You know, does he have, I mean, does he have a what do they call it, a post or I don't know that he would want to do not resuscitate, but maybe that is something that the family needs to talk about with him before he can't talk about that for himself. And the suggestion is also to connect them with community resources. I'm sure I have not researched what's available in Monterey County, but I would think that they have at least a few groups related to Alzheimer care and family support groups.
Yeah, maybe they can see if he qualifies for like Medicare or Medicaid if they're having financial problems. And I know for my mom, I get paid to like run her errands and stuff. So maybe like they could maybe they can find support for someone, like for a caregiver for
Yeah.
him.
Yeah.
So so they don't have to have all that in their hands because
All
it's
of that. Yeah. Back to that caregiver stress,
yeah.
right? Yeah. So good. I think you guys pretty much, Nicole or Elise, did you want to add anything to that one?
Oh, I was just wondering if you can clarify like what the expert response was supposed to be for this one, because I said connect them with community resources and also evaluate the extent of their financial concerns so you can further
Yeah.
into how you're going to assist with that.
So this is what they put. Can you see this screen still?
Yes.
So the provide ongoing up-to-date information about them. You know, I imagine if you're trying to, as I said that about FaceTiming or with the phone or whatever, I guess there's going to come a point in this situation with COVID going on that he may not even understand that you're on the phone. So I think kind of progressively coming up with different ideas to still keep them connected with him and communicate. Is that good? Did you need more, Nicole, or is that good?
That's good, but I was also wondering what the expert response was for number 6. I know we said physical therapy and occupational therapy. Was dietary definitely one? Okay.
Yeah, dietary, social worker, occupational therapist, physical therapist, and speech therapist.
Perfect, thank you.
Uh-huh. Okay, so who wants to take number 8? I think it was Lynn. Is that your turn?
Yeah.
As she sits there so quiet.
What factor? Wait. KB's family decided to place him in the Alzheimer unit. During the first few days at the facility, he is very restless and agitated. constantly wandering around the unit. He has slept only 2 to 3 hours per night. The UAT reports to you that she just
Oh,
found him sitting on the bathroom floor, incontinent of urine. What factors
oh.
are likely contributing to KV's wandering and restlessness? Maybe because he was just placed in the facility and he's confused about everything.
Yeah.
Like this is a new place and he's not used to it.
Anyone else? Elise?
Well, what about sundowning?
I know I was kind of thinking that, but I think, I mean, I guess sundowning is probably a little bit like this, right? I mean,
Yeah,
but
yeah, because I was
specifically for
that's,
the Alzheimer disease patient.
I was looking in the Cooper, it says something about sundowner.
Mm. I mean, it makes sense. So think about, he was already kind of, well, the reason why the family put him here, because he's very agitated, confused, being in his own place. Now in his own place where he's been for years, now you've just plucked him out of that and stuck him in this facility where he doesn't know anybody. The routines are all different. And so he's just, it really kind of has sent him over the edge a little bit, that he needs to have time. You know, I'm just thinking, you know, is this something that they need to adjust medications or anything like that on? I can show you what it's kind of one of those questions. So they said people with AD have a lower stress threshold and their ability to cope with stress declines as the disease progresses. That makes sense, right? Wandering can occur when demands, i.e. unfamiliar environment, exceed the person's threshold. AD patients with physical or psychosocial needs, such as needing the toileting assistance or need to find someone familiar, are more prone to wandering. So he, you know, he could have even been looking for the bathroom and then just got confused that that's what he was looking for. And then that's really sad though, isn't it? So as you develop KB's plan of care, what do you think is the highest priority for him?
I feel like it's the chronic confusion because that can lead to the risk for injury. Like it can lead to everything else that's listed.
Okay. But they want to know, let's see. Yeah, that's kind of hard. That's really a kind of question, I think, because I think I could see where you're thinking there, Nicole, that the answer they put is risk for injury. Maybe because the confusion is chronic, that's why it would be risk for injury over that. What do you think?
So it's not chronic confusion?
No, it's risk for injury.
Oh, okay.
Yeah. And that's the only thing I could think of, because I mean, if you just said, what's the highest priority? So this is, you're thinking of your plan of care. You know, I would probably put risk for injury because I think safety, that's what I'm thinking. What do you think, Nicole or Elise?
I mean, maybe it's not chronic confusion because he was on that medication to help with cognitive issues, so maybe that's not like the primary issue. I understand where they're coming from with risk for injury, but the way that I look at it is if he's chronically confused, that could lead to injuries, urinary incontinence, and impaired communication. So I was thinking that chronic confusion was the priority here.
Yeah, and maybe also there's really nothing we can do about it either. Right? Because he's gonna be progressively more confused. And the one thing we can do is protect him from falling or from injury. That, I think that's how I would kind of work it in my head. So what other medications might be prescribed for him? What do you think?
It says lorazepam and haloperidol.
So what are those as far as
The haloperidol is used for agitation,
Okay.
and kind of and to prevent hallucination.
so that's more of an antipsychotic, right? What other ones?
They also have Zoloft here, which is a antidepressant.
Yeah.
They have trazodone. There's several.
Say that one. What was that?
Trazodone. They have the trazodone listed here.
Oh,
It's in the book, in the
what is that one? Is that a
antidepressant too. But
okay.
for trazodone, they can use that for sleep too. It's a
Is it a
they have trouble sleeping. Trazodone can be used for sleep. That's what it says here in the book.
okay? So they just list them in. They don't give you specific ones here, which is probably good because there's probably so many you could choose from.
In the Cooper, there's a whole bunch of them on here under medical management for it.
Right. So there's antidepressant, antipsychotic,
Yeah, and trazodone for sleep.
anticonvulsant, a sedative,
So
and anti-anxiety. So I'm sure they don't like give them all of these. I would think that it's kind of like a little,
no, they just have different ones listed that they can give.
right. Any questions on that one? So the antidepressant says that it'll help his depression and irritability, that about a quarter of these patients have some depressive symptoms. The antipsychotic will help his paranoid behavior. In the anticonvulsant, it actually says will help the aggression or hostility that he might be having. A sedative helping him sleep, and anti-anxiety for the restlessness and the verbally disruptive behavior. So since our class, I mean, you have pharmacology. So if I were to ask a question like this on the exam, it would be put in something like this, okay? Like it would be an antidepressant, or the expectation wouldn't be for a specific medicine. Okay, because you have pharmacology, right? Okay. So true or false, a patient with Alzheimer's is not able to sleep without drug therapy.
False.
faults. Yep. So he would be one, as soon as, I feel like as soon as somebody like this, and maybe he's because he's stage 5 is what we thought about. I would think the sooner you get him on some sort of schedule, get some surroundings that he feels comfortable with, maybe have the family bring in things that he might recognize, have a real tight schedule, like maybe have him, I don't know, I know they don't shower them at night probably, but I mean, take a nice bath, or take a short warm shower, have some warm milk, you know, all of those things that might calm him down and get him to sleep on his own.
So
Yeah,
I'm
What's-
understanding that sedative medications are only PRN. They're only given PRN.
it would depend on how the doctor ordered it. I think typically that is true. Unless you had a client that every night that without these, that it's proven that he can't go to sleep. But I would think that's kind of one of those things that would be written as a PRN. Okay. So describe 4 interventions that may promote a normal sleep pattern. Sorry, my dogs are like just sick. They want my attention. Just sick. They think this living room is their big playpen in here. It's like, so, okay. So what do you think? What are some 4 interventions to help them sleep? We're all ready to go to sleep. Claudia looks exhausted.
I would say,
I know.
oh, sorry.
Go for it, Nicole.
I would say establishing a bedtime routine. Like, I know the textbook, and we always tell people to try to go to bed around the same time each night to get yourself on a regular routine, so you like start to get tired and are able to fall asleep at night.
Right.
And
Yeah.
then avoiding caffeine, sugary drinks, sugary foods, stuff like that later in the evening.
Yeah. Don't be watching, I mean, watching TV, being on a computer, but I don't know that he would be, but you never know. Anything else, guys? 4 interventions.
I'm pretty sure there was also something sometime, I forget what lesson it was from. I think it was last semester when we had the concept chapter on like sleep or whatever. But I remember it saying to ensure the room temperature is comfortable to the patient, like usually decreasing the temperature a little bit at bed so you can sleep more comfortably.
Yep. Yeah, I like that. Let's see, room temperature. Make sure room temperature is comfortable, provide night lights. Oh, that's a good one. And security objects, and try to keep noise at a minimum. I'll tell you, some of I've gone into some of these, I don't know, do you call them convalescent care or long-term care? I always seem to call them convalescent care, but there are
Trouble.
There are some people that are screaming the whole night. How does a patient that is right next to that person who's screaming, how is that other patient supposed to sleep? Maybe in these kind of facilities, they don't have clients like that, but I bet they do. So yeah, so maintain regular meal times. And like Nicole said, getting up, go to bed at a certain time, get up at a certain time. And if he had any nighttime rituals that he used to do at home, maybe he had a cup of herbal tea at night or something, then let him do that. And keep him awake during the day, right? Then he's less likely to have problems sleeping And then Nicole said about in controlling the actual temperature. So which interventions on number 13, let's see. So on number 13, which interventions would you put as the highest level? Let's see, which interventions would help KB function at his highest level possible? Select all that apply. Someone want to take a stab at that one?
I'll say A for now.
Okay.
C. Sounds good.
A, C.
I would also say B because that helps establish a routine. So as his condition progresses and he becomes not as like oriented, he kind of understands what he does during the day.
Right. Yep. Good. You got them so far, guys. There's two more.
E. And then I would say D too.
Yeah, me too.
Yes. Yeah, you can see why encouraging them to perform cognitive skills, what would that do to him?
I think it confusing even more if it's above his comprehension.
I feel like that would discourage the patient too. Like I know that in the situation with my dad, I have to be very careful about the way that I talk to him. Like it's becoming very evident now that he just kind of forgets everything, and everyone in the household around us recognizes it, but we try not to bring it up with him to make him feel worse because we understand that his condition is progressing and there's nothing we can do about that.
Yeah, good. Yeah, I mean, it just seems like it would just stress them out. Having that part of your mind knowing something, but not being able to grasp the words or the action that needs to go with that. So that wouldn't make for very easy sleeping right after that, right? Or if you had a day of that. So number 14, Elise, number 14.
Okay, it says you are concerned KB is not able to verbalize his needs. Write an outcome addressing his issue and identify independent nursing actions to promote communication. Able to, I have to think about that one for a second.
Let me do something. I just lost our paper.
Wait, Ms. Thorpe, I'm sorry. Was number 13 all of them except for F?
Yes, correct. So what do you think? You want to take a stab at this? What kind of outcome? So he's not able to verbalize his needs.
Maybe a board like that has pictures on it or something. If he's not able to verbalize, maybe you can point at the board. Maybe he, familiarizing with a board. I'm not really sure. I'm just thinking.
No, that's a great idea, Elise. I like that.
Yeah, that, and just maybe reorientating him a little bit, or just like, reiterating something.
Like each time, yeah.
Yeah.
That's pretty much what they say. It's KB will communicate needs with verbal. This is an outcome statement. Okay, so the outcome, KB will communicate needs with verbal and visual cues as long as possible. Provide only one instruction or visual cue at a time. Make KB's attention when speaking to him. use a variety of nonverbal technique. Like you said, point, touch, or demonstrate an action while talking about it. Ask him to point to parts of his body or things he wants to communicate. He is searching for a particular word. Guess at what is being said and ask if you are correct. Use cue cards, flashcards, and pictures. Encourage reminiscing about happy times and accomplishments. I've done some reading on that with elderly in general, that they've started to do studies. Music that they used to listen to, you know, let's say they grew up in the, I don't know, he's 76, so, you know, probably his what would be his teen years would be the 60s. Maybe play some music from the 60s and see how that helps, because they actually are starting to say that kind of helps connect, like wake up that part of the brain almost, and that they actually do better with some of the things you want them to do. Kind of makes sense, right? Like reconnecting those neurons in that spot in your brain.
Yeah.
What do you think of that, Nicole? You think that?
Sorry, can you repeat that?
I was saying about using music, and it's specifically like be for these people, like for your dad when he was a teenager. What kind of music did he like to listen to? And having that kind of music play, you know, kind of low, and see how they respond to that. That it might wake up a certain part of the brain to help them do more.
Yeah, I feel like it helps. Like, as far as my dad goes, he still tries to do all the things that he enjoyed before he was diagnosed with Parkinson's and before his condition progressed so much to the point where it's like affected his ability to walk and drive and do all that stuff. He still goes go-kart racing whenever he can. He still listens to the music that he listened to growing up and enjoys. He'll go to concerts. He went to the Indy 500 like a few years ago with his friend John, and like still hangs out with his friends from high school and that he grew up with. So I think that kind of helps make him feel like he's not like a non-functioning person.
Yeah,
To put it bluntly.
that's really cool. Yeah, that's awesome. So your last one is on what activities can you give to the CNA to do out of these?
I think it's all of them except D, because I don't think a UAP can assess anything. But I think that she could assist him with eating and help him with his morning care and ambulate him to help him use a bathroom and encourage him to take care of himself.
Yeah,
But I don't think that she should be assessing him.
you are 100% correct. So it's everything but D. D as in dog. So, and then they have the ending. So good job, guys. Was that helpful?
Yeah, I think it's the most
Very.
helpful when we go over it, because the few times that we've had to do them on our own, we're all just kind of
Stuck.
lost, and it's like I'm consulting with Google for help and I don't know if it's always correct. And then especially if some of these questions we may see on future exams as like short answer questions, it's helpful to know that we've already gone over it and we've clarified what the correct answer should be, so we know the correct thought process to think through the question.
Okay. Yeah, I mean, I love that you guys showed up. It makes things so much better. Obviously, I can't do this on my own. I can't ask myself the question and then so, even just having, 4 of you guys show up, it's so much. I'm like, oh, I actually have students in my class. I don't just grade papers and stuff.
Can we keep
So, huh?
Can we schedule this weekly?
I can, yeah, I've actually been scheduling. I've been trying between Monday and Wednesday to do this, but I haven't had any takers. I think Lynn was the first one that said, oh, I can come, I'll try to get there after. And then I was glad to see you guys. So yes, if this time works for you guys, we can do this next week too. So I think what I'll do is you can see, can you still see this PowerPoint over here?
Yeah.
Yeah, we could see
Okay.
Millie.
So I'll just kind of do some tweaks to this and I'll probably just post this. So that's what I'll do. There is a, it talks about Millie a little bit at the beginning here. If you guys want to do this one, and I can put it out. I ended up closing it, but if you get to that point and you want 2 extra points, this was just finishing up talking about Millie, but we can do that another time too. So
We can do it now. So we can.
no, I gotta go. I'm gonna be going blah 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 blah. Don't you guys? What time did you all get up?
I'm getting up at 4 a.m. tomorrow for clinical.
I know that's the way my Tuesday and Wednesdays are. I get up at 4:15. So that's why it's like, okay, but yeah. I promise, I have some times open tomorrow. Some people filled in. I'll just open this PowerPoint up, okay? And if you have any, I'll post it tomorrow morning. If you have time, go through it. The reason why I kind of was thinking it would be, let me show you. From current slide. So there is, and it's probably in your book too, but in this one, it talks about the different confusion assessment method. Going to these different links might be helpful. Let me see, I can pull this over here. Oops. See if I can pull this over here. So these different links take you to some of these tools to use. Okay. Your book probably talks about a couple of them. Anyways, I'll just post this if I'll put an announcement up, okay? Kind of when I figure out exactly what is, because this here, after you get past Millie stuff, is going to be the concept stuff, the caregiver concept, okay? The theoretical links and all of that stuff. It's more the book stuff that you might want to look through those. And another hint, a lot of times I will take these questions from here too, especially for the quizzes, because I always feel like the quizzes are kind of a hodgepodge of stuff, okay? Does that make sense, you guys?
Yeah. Makes
Okay.
sense. Thank you for helping us.
Oh, you're welcome. Thank you for showing up. Are you good, Nicole?
Yes, thank you.
Okay. All right, guys. I am going to, I can't figure out how to, oh, maybe it's here. All right, guys, I'm gonna go ahead and end it, okay? I just have to figure out how to stop the,
Okay. Okay.
okay? All right,
Thank you.
bye, guys.
Bye.
Bye, have a good night.
Bye.
Bye.